As our implants have improved, our surgical techniques have improved, and people staying active longer, there's really been sort of a confluence of reasons leading towards more shoulder replacements. What's disturbing as a sports medicine doctor who specializes in shoulders is a trend we're seeing with younger patients with arthritis. And that's a really tough group to treat because shoulder replacements work great. They work great in 70-year-olds, 80-year-olds who are lower demand. When you start putting shoulder replacements in 40 and 50-year-olds, people who you know are going to sort of do too much or beat up this artificial joint, it starts heading down a bad path. So one of the big advancements or innovations in shoulder arthroplasty or shoulder replacements has been this sort of focus on patient-specific planning and instrumentation even. So we'll take the patient's X-rays and CT scan and MRIs, and using those, there are multiple different software programs that allow us to really plan the surgery before we're even in the operating room. Another innovation as it relates to young patients with arthritis are sort of more bone-sparing type implants. You know, the more of the patient's native bone that we can preserve while replacing a joint, the better. So we've used shorter and shorter stems as it relates to doing a shoulder replacement. On the socket side, we have better fixation.